Good afternoon. I'm Ed Poswoli, president of TrippScott, and we're here with another installation of the TrippScott webcasts. Today I have Betsy McCoy, and Betsy is a healthcare expert as well as been lieutenant governor of New York, but has written several books about, and one of them is about beating Obamacare. And Betsy, this law, it's sitting in front of you.
That's right, here it is. All 2,572 pages.
And they look pretty earmarked there, so I take it you've been through it pretty good.
Yes.
So tell me let's start with the individuals, because the website issue, maybe you'll get fixed, maybe it won't.
Yeah,
but
that's trivial.
That's trivial.
That's a distraction.
Okay. So let's talk about the actual law and the impacts on the individual's ability to obtain health care.
Well, if I could summarize it, this law lowers your standard of care. It puts government in charge of your care and your doctor. And it takes away something as precious as life itself, your liberty. The law says that you will have to enroll in the one-size-fits-all government-designed health plan. When you go to file your taxes, you have to attach proof that you are enrolled in that type of plan, or you will lose part of your tax refund. This law empowers the federal government for the first time in history to dictate how doctors treat privately insured patients. So if you go on the exchange and you buy a plan and pay for it entirely yourself, right? The federal government, the Secretary of Health and Human Services, is still in control of your care. Section 1311H of this law says that those insurance companies can pay only the doctors who obey whatever regulations the Secretary imposes in the name of quality. Well, that could include anything in medicine, whether your cardiologist recommends a stent versus a bypass, whether your OB/GYN orders a cesarean or a sonogram.
But what's wrong? I'm going to be devil's advocate just for a second. What's wrong with trying to provide people who don't otherwise have insurance with health insurance?
Oh, I'm totally for that. That's not what this law does. That's how this law got passed. The president said, if you like your health insurance, you can keep it, period. If you like your doctor, you can keep your doctor, period. If you have health coverage, you don't have to do anything or change anything, period. And we all bought into that,
right? Because
we do want to help the uninsured.
Well, can you keep your own plan?
No. The president understood that people didn't want the government nosing into their medical care. So he promised that it wouldn't involve changes for the rest of us, but that's not at all the case. The fact is, if you have health coverage, it will change. It's already changed. Whether you're in the individual market and you've gotten one of those letters that your plan is canceled.
300,000 people in Florida last week.
Exactly, and over 4.5 million so far in the U.S. It'll be up toward 12 million before it's over. If you have on-the-job coverage, that's how most people get their insurance, right, through an employer, their own or their spouse's.
My law firm offers it to our employees.
Right. How many people are in your law firm?
180.
Right. So chances are you're going to have to change plans. You're going to have to make sure that your plan provides the 10 essential benefit categories. It's going to be a one-size-fits-all deal. It's kind of like the government passing a law that car dealers could only sell four-door sedans. No more hatchbacks, no more convertibles. The assumption is we're too stupid to pick the kind of health insurance we want. So everybody has to have the same.
So this is not just a cost issue, although costs are going to rise. I mean, I've heard anywhere from 40 or 50% from a healthy young male in Florida, as an example, having to pay almost twice of what he's paying now, or somebody who is less, let's say a woman who is a little older and maybe has a couple of health issues, maybe 20% more. But it's not just about cost. It sounds to me it's about freedom.
Because the fact is, if we all had to pay a little more to help the uninsured, count me in. I don't want anyone to lose their home or a lifetime of savings because they get sick and they don't have health insurance. This is taking away your freedom to choose what kind of health insurance you have, or even if you have any, right? And secondly, your freedom to make decisions with your doctor about your own care. And that is really dangerous because it's pushing down the quality of care to a kind of lowest common denominator. For example, the exchange plans. You can't go to the top drawer academic hospitals once you sign up for one of those plans.
Why not?
Because they're not included. Those plans pay doctors and hospitals very low rates, like Medicaid rates.
Right.
So in New York, for example, only about a quarter of doctors are willing to participate.
The other doctors are not participating
No,
at all.
no.
So those doctors would not be available to anybody with an exchange.
No, and those hospitals, New York Presbyterian, which is the top drawer, one of the top drawer hospitals in New York, is only participating in one out of the many plans in New York. Out in Los Angeles, Cedars-Sinai, no. University of California hospitals excluded from almost all the plans. And so you don't really have the choice to go to the kind of hospital you're accustomed to going to. The law specifically says that the exchange plans have to deal with what they call essential community providers, which are like public hospitals that provide care to the poor.
Right.
They want to make sure that the poor don't have to change hospitals as they go in and out of Medicaid and onto the exchange plans. But that leaves other people forced to give up the high quality care they got.
But why do I care? I mean, I've got 180 employees. Many of my clients have, they're over the 50. They provide their employees with health insurance now. Why do we care?
Many of them are going to drop it.
But why? We're just talking about now. We're just dealing with the individual mandate issues. But what about? Why do businesses care who offer employees health insurance now? I mean, it doesn't seem to affect them, or does it?
Of course it will. It will. It will. All of these regulations affect not just the individual market. You're seeing the fallout there first.
Right.
But in the coming year, you're going to see the small group plans, many of them canceled, and others you'll see 20 to 30% increases in the premiums. That impact has been slightly delayed because cleverly many of those insurers renewed early to avoid the deadline. So instead of having the fallout in October, November, December of 2013, they're going to get it right before the 2014 election. Not so good for the politicians in Washington. And then even the large insurers and the self-insurers, don't forget that's the biggest part of the market, the self-insurers. They're also feeling this impact. Take Delta Airlines.
Right.
They're experiencing $100 million increase in their insurance costs in the coming year because of regulations in this law, even though they already provided coverage.
But the individual mandate doesn't apply to them.
No, but as I said,
But
in
the
this
standard-
law, there are many rules and regulations that affect group insurance. For example, all the companies have to provide insurance for kids up to age 26. Well, that's a nice thing for many families, but it added, according to Delta, $14 million a year to their tab. They had to eliminate caps, annual and lifetime caps on coverage. That affected many plans. And the more regulations they've applied, the higher the costs get, and more employers are incentivized to drop coverage. And frankly, the politicians in Washington have forecast that millions of people will lose their group plans.
It sounds to me that might be beneficial to the individual exchanges, though.
Well, that's right. And that's why I don't think you're ever going to see the employer mandate. Even though it's in the law, the president very quietly and probably illegally changed that last July 2nd. He just slipped into a Treasury blog that they were not going to enforce the employer mandate in 2014. They did it because that created a much larger pool of individuals who wouldn't get on-the-job coverage and would have to go sign up on the exchanges. Hasn't worked so far.
Right.
But first they tried getting the NFL to sell the exchanges and the NBA, and they said no. So this was kind of a last desperate ploy. We'll postpone the employer mandate. But still people aren't signing up. So I don't think you'll see the employer mandate, because if you do, the chances of the exchanges succeeding is much smaller.
Right. So they need people to sign
They
up
need
for the
the
exchanges.
bodies, right.
Wait a minute, what, 6 people in D.C. I think signed up the first?
No, I called New Hampshire this morning, none in Oregon, just nobody.
So 2,500 plus pages worth of legislation, and God knows how many pages of regulation around it.
Right. You know what makes me sad? Because I love healthcare. It's very important to me. Right?
Obviously, you have a passion for it.
Right. When you look at the government's own projections, spending on healthcare administration, That's not doctors and nurses and bandages and surgery.
Right.
That's people pushing papers around and writing rules to govern us, right? That's increasing from $29 billion a year in 2008 to $79 billion a year, not helping anybody. That's a tragedy.
So $79 billion is the cost of administration.
Yes.
Without
Per year.
without
Can you imagine?
handling little Johnny's fever
Right.
or Mary Jo's pregnancy
Just
or
Washington rigmarole.
where are we going with this 5 years from now?
I believe that in 2014, people will go to the polls, not just Republicans, Democrats, independents, people who have lost their health plans or lost their choices or feel they've lost their freedom, seniors who are really getting clobbered under this law. They'll go to the polls and they're going to pull the lever for somebody else, somebody who's really committed to repealing this law. 2014 will be a referendum on the Obama health law. I thought 2012 would be. Things didn't play out that way. But 2014, I'm quite confident will be because we're all feeling the pain now. Seniors the most.
Why seniors?
Oh, well, over half this law is paid for with cuts to Medicare. Over half this law paid for with cuts to senior care.
It's got to impact something.
Well, it does. $716 billion taken out of Medicare over 1 decade, including $247 billion less money to pay hospitals. The hospitals are already laying off nurses, spreading the care thinner. You can see it in Florida and California, everywhere. In some places, nurses are already striking because they can't take the workload.
Right.
And that means no matter what age you are, when you press that button for help, you're going to wait longer. And I'm urging people who know they're going to go to the hospital to try to cobble together enough money for a private duty nurse, at least for the first night.
So what you're saying is we should anticipate less health care for more money, impacting greatly on the individual choice and freedoms that we have around making individual medical decisions for ourselves and our families.
That's right. And by the way, if you're a baby boomer, you look like a young, handsome baby boomer. If you're a baby boomer, line up your doctors now, even if you're healthy. Line up a cardiologist, line up an internist, because if you wait till you turn 65 and go on Medicare, you won't find a doctor willing to take you on, not as a new patient.
Betsy McCoy, thank you so much. And I hope you enjoyed that presentation about Obamacare, and certainly gives us a lot to think about. Thank you.